So the procedure starts with a short plastic tube called a sheath being placed in the femoral artery, which is at the top of the patient's leg. Through that, another longer, stiffer tube measuring about 90 centimeters goes from the blood vessel in the leg up to the blood vessel in the neck. Through that, another tube is telescoped up into the blood vessel in the brain, and through that, another tube is telescoped, which is a tube like this one. This is called a microcatheter, and it measures somewhere between 0.5 millimeter and 1 millimeter in internal diameter. So it's a very fine tube. And this is taken up into the blood vessel that's blocked, and it's actually taken through the clot using X-ray guidance. So the tip of it then will sit beyond the clot, and through the hollow tube then the stent, which is the device that removes the clot, is passed through, and we push the stent out from the other end. So if you just watch that bit there, I'm pushing the stent out from the other side, and this is the stent that we use. So this stent, for example, measures 4 millimeters by 20 millimeters, and the stent is attached to this wire, so it doesn't get left behind in the patient's blood vessel. It will sit across the clot, and the very fine wires of the stent sort of cheese wire the clot. And once the clot has been incorporated into the stent, then the whole system gets pulled back into the tube that I mentioned earlier that's sitting in the patient's brain, and that there's suction on that generally. So then that just gets pulled back down, and the clot along with the stent is removed into those other tubes and then removed from the body altogether.